Hello. This is about the ID 1130 in this conference. So I will talk about missions of organizations for people with disabilities, and I'm Ceren Karaatmaca, and in this research we worked with my professors Fahriye Altinay, Mehmet Altinay, Zehra Altinay, and Gökmen Dagli. And what I will talk about is first the background and the introduction part about the disability organization, about disability, and the mission statement. What's the mission statement? About the aim, the research questions, about the method, which method we followed, and about the findings of the study, like the common categories and cause for mission statements of the Disability Association, and based on member interviews. So also checking out the similarities and differences about the codes and the categories. And also in the last part, in the last section, I will talk about the discussion and the conclusion. So first, the background and the introduction part. So let's explain, or let's talk about disability. So when we look at the Declaration on the Rights of Persons with Disabilities, it says about the disability or disabled person, or the person in special needs, as people who cannot function by themselves as a result of any deficiencies in their personal or social lives. And the causes of limitation of mobility may be caused by a dysfunction during the delivery of that person, or it could be caused by a disease or by an accident in later in life. So also we must keep in mind that disability is often a variable subject. So it depends on where and how the results are encountered. So this is a thing that we should keep in mind. And when we look at disability organizations, these organizations represent a certain disability cause or an issue, and they usually act like an advocate of that special area. And when we come to the definition of the mission statements, which we also are explaining in our article in detail, all these terms, it's a statement explaining why an organization exists. Simple definition is this. And it's also an association's philosophy, logic, or fundamental beliefs and explanation behind being. So that means why there's an association or organization like that. From now on, I will usually talk about this organization definition as association. It's the same thing. We must think like that. And before the aim of the study and the problems of the study, we should talk about the emergence of the study. And if there is this inconsistency between the mission statements, as I explained, and the perspectives of the members of that organization, then there will be problems in operation and efficiency. And for consistency and continuity of that organization, they should be in parallel, actually. So coming from this emergence part, we come to the aim and research questions. So our main aim, was to monitor and evaluate the mission statements of associations in educational services for disabled people, and to explore the points of views of the members of the associations on what mission statements should possess, actually. So the main question is, does the content of this mission statements really meet the needs and concerns of the members? In real life, we could see most of the time the concerns about not being two of them in parallel. So when we come to the method part, first of all, about the research design, it's a qualitative research model, a case study, and also a situation analysis model from case studies, and it's the analysis of an event or subject from different perspectives. So when we talk about different perspective in this case, as I said, we are checking out first from the association part perspective and the members of that association part. And when we look at the method and the sampling, the sample frame of all the associations in North Cyprus and North Cyprus Ministry for Internal Affairs provides a complete list of 1,628 member associations. And when we looked at the type of the associations, they are the environment, the solitary, religious, education, retired people, women, culture, occupational, health, arts, sport, traffic areas. And disability focus associations, the active ones, are 30. And also, we chose 15 members of these different disability focus associations, and we made a non-active sampling to interview. And when we look at the sampling more in detail, when we check the associations, in these 5 main areas of North Cyprus, that's Lefkoşa, Nicosia, Kyrenia, Magosa, Güzelyurt, and Iskele. In North Cyprus total, as I said, 1,628. We see this 13 disability-related associations and the active ones. And when we check the sampling member for the interview, when we look into the details, when we see the gender, as you see here, the male and female, and we also checked in the year in association as a member, age, and total we had 15 people to interview. And when we come from the data collection tools, first, as I said, we check the missions of associations from their strategic plans, and also we interviewed with 15 members from different disability associations. And when we come to the data analysis, in generally in qualitative research data, it starts with first the coding of the data, then defining the themes and editing codes and the themes, and lastly, identifying and interpreting the findings. And we also read the short categories, and with the aid of the computer-assisted qualitative data analysis software, QDA Miner. And when we checked about the findings from the mission statements, we come up some or certain category and codes, as we see here. So the first one is the accessibility, which is like 17.54%, almost 18%. We have another category, disability awareness. We have another category, economical, education, then politics, social life, and sport. And under it, we came out with certain codes. And with certain codes from the mission statements. And in the same way, when we checked the interviews of the members, we see almost the same codes, but the percentages differ. So we are looking in detail in this qualitative design research actually about the differences and the similarities between these two. We'll talk about further. So when we talk about the common categories from associations and the members, we see basically the basic needs, the family support, and rehabilitation. So that's a quote from one of the associations, Kıbrıs Türk Ortopedik Özürler Derneği. That's the center aims to increase the quality of life. I'm reading directly. Quality of life and the people with physical disabilities to the maximum independence by providing the functions that can be gained by physical therapy rehabilitation, not only by the disabled people, but also to ensure their integration in the society in the best way. And when we checked the differences for associations and the members, the main difference, first of all, is the accessibility. And this was the high category for associations, which was coming after the sport category, which was commonly the highest rank for the associations. And we work for the technologies that are accessible to everyone. And when we look into detail the significant differences for associations and members, we also come to the economic issues. And this category is the not the highest one in the association, but the highest in the members part. So I will quote here one of the members, or actually two of the members, is saying, due to economical, member 6 is saying, due to economic difficulties, I couldn't get a suitable car. And because of the lack of the public transportation, I wasn't able to get into any business. Therefore, I believe that economic challenges and transportation should be included in the mission. And another thing, that's the member 9, the government promised us last year for employment. We sent a CV to them during a meeting and there's no news yet. So I personally think the mission statements of disabled associations should definitely cover the employment problems and unemployment problems and economic difficulties of the disabled people and our families. So also we talk about the support function, and many early intervention services now endorse a family-centered approach. So when we come to the discussion part, and we can say in other related researches, we also see similar result as a support function. And in our article, we are also talking about this support function in detail. So if I can give a snapshot on this one, many early intervention services now endorse a family-centered approach that emphasizes family support and parent education in addition to specific services related to child's disability, for example. That's one example. And one assumption of this program is that beneficial effects will accrue not just to the child, but also to parents, siblings, and the family. And another need was a rehabilitation need and problems on healthcare in terms of primary care service. So the participants who are the members of these organizations emphasize especially difficulties even in contacting a doctor for their needs. The rehabilitation is the second one. I mean, they first emphasize difficulties even in finding a doctor. And And they say the focus should be in the improvement needs on the primary care services. And although there are centers which address the medical problems of people with disabilities as FTR, we can say, physical therapy and rehabilitation, under legal control of some disability associations like Kıbrıs Türk Ortopedik Özürlüler Derneği and some rehabilitation centers in some universities and hospitals, these services to disabled people with clinics should be improved also under the control of government. And also it should be taken into consideration that most of the families of disabled people need even support to reach these centers. So the most important point, lastly, is that to have an FTR is not alone enough. You can have an FTR, but the needs should be told in broader sense, like transportations, like education of the families, and the economic issues. So in further sense, we are discussing more in our article, but thank you so much for listening to us, and it was nice to give this information to you. Thank you.